You can start.
Uh, Hello, I'm Ridula, one of the kids doctor working here.
Yes, doctor.
I believe you are Miss Mary, mother of Sam, 11-year-old.
Yes, doctor, it's me. I'm Mary.
Hello, Miss Mary. Thank you for coming to meet me. Is it right time to discuss the blood results of Sam?
Yes, yes, doctor. Is there anything serious?
Before we start, would you like anyone else to join?
No, doctor. Everyone is busy. I am here. You can go ahead.
Okay, Miss Mary. So before we start, so we have already checked the blood tests which are done and the results are out. Unfortunately, the blood results indicate that Sam has a condition called as diabetes type 2.
Oh my God. What is this, doctor? I don't know really. My child is very healthy and he's fine. I don't see any problems in him.
I can see you are very much tensed seeing this diagnosis. But you would have observed Sam was actually, his weight was more, and that's why you have brought here for doing some tests, and we have done those tests, and all of them showed this diagnosis. So, have you heard about this before? About this diabetes?
Uh, yes, doctor, I know diabetes, but I doubt that my child has diabetes because my sister has diabetes, and before she was diagnosed, she used to go to pee many times in the night, and she has lost her weight, not gained her weight like my son. And I don't think here I see a contrast. He has gained weight and
SURAH
he has more weight.
ثم
And
الليلة لديكم مقدم أربعة والخميس والجمعة والسبت الاثنين الثلاث الأيام.
okay, continue.
I can really see that you are very tense hearing this diagnosis, but the presentation can be different. So even in children, the presentation can be different. It's not the same that everyone will have the similar kind of thing. So as a team, we are all working for the best interest of your child. So so we want to share with you the information regarding this so we can do the best for Sam.
Okay, so how you got to know that my child has diabetes?
Yes, Miss Mary, I'll explain you. So we have done some blood test called as HbA1c. So and also blood sugar, fasting blood sugar, and also some fat related blood investigations. So in all these investigations, they have shown that the sugar levels in the blood are high. So whenever the sugar levels in the blood are high and the fat are also high, this indicates that this is diabetes. Also, there is a test called as HbA1c. So this reflects the sugar levels of 2 to 3 months previous sugar levels. It's not just one-time analysis.
So, doctor, now what you will do for him? I am very much worried. I don't see any symptoms in him, and you are telling he has diabetes, which is quite opposite to what my sister I have seen. So, what do you do to him?
Yes, Miss Mary. Before I explain you how we can manage, can I explain you why this has occurred, and so that it will be easier for you to understand how we can manage, Sam?
Okay, no problem.
So as you already know, this is due to raised blood sugar levels. So I'm showing you this picture. Whenever we consume any food, it is actually in a complex form. It is broken down to simple form called as sugars. So these sugars have to be absorbed by the muscle so that we can effectively work without any tire. So to get it absorbed inside, so you can imagine every muscle will have a door, and to open this door, you require insulin. So So what happened here is we have key, but the key is not properly fitting into the door. So this is what we call as resistance to insulin. So insulin is there in right amounts, but it is not able to work.
Okay.
Have I
What
made
is
this clear?
Doctor, can you explain me what is this insulin?
Yes, right question. So insulin is a chemical substance. So this is produced by a leaf-like gland, which is just there below our tummy. So below our tummy, we have a leaf-like gland, and this produces a chemical substance called insulin, which helps us to use the glucose so that we can use the energy, can get the energy.
Okay, okay. I got to know. So now, so how do you provide this insulin to Sam? You will give injections?
I'm sorry if I had misunderstood. I have made a
Minutes left.
Okay. So here Sam has adequate insulin. What we just need to do is to give Sam adequate exercise, change his diet so that the sugar level, simple sugars come down and complex sugars are there so that little amount of sugar is placed. And also we can do some lifestyle modifications. I can introduce you to a dietitian who will explain you what diet would be beneficial. And also we can also introduce to a nurse, diabetes specialist nurse. She can also tell you some of the lifestyle modification. If Sam starts doing all this, we can wait and watch because in most cases, this resistance, which I was telling, will decrease and the body starts to utilize glucose, and there are chances without any medication, Sam might become normal.
But doctor, I
Uh,
see when my sister was diagnosed, they said that this sugar will not be controlled, and they need injections after every meal, before every meal, and all these things. But I don't know. This is going in contrast way. Why? How do you control just by lifestyle modifications? But if it is not controlled even by life changing his diet and all, I don't think he will manage with changing of this diet because he loves eating a lot.
I can understand your concern. Your sister would have had a different type of diabetes called as type 1, where insulin is needed in injection, which is a must. But here, Sam has type 2, where insulin per se is not needed because he already has good levels of insulin. We just need to decrease the resistance so that insulin works well. So here, exercise and diet works well. So we have a dietitian who will talk with Sam and will note down what Sam likes. And it's not like entirely we have to change on a 180-degree basis. We can start with slow changes. Whatever he likes, we can take some of them which are good for him and also which he likes. Are you with me?
Yes, yes, doctor. But if it's not controlled by these measures, what you will do?
Even if after the diet exercise, if it's not controlled, we also next level is starting medication. But this medication will be starting only after we have given a good trial of all the diet, lifestyle, and exercise, everything.
Okay, okay. So here you will not give injections for them?
No. We can try tablets. We have oral medication which can be used.
Okay.
So, do you agree with our plan?
Yes, doctor. 9 minutes, huh? You can make a summary fast.
Okay. So I will just go through what we have discussed again. So we have discussed about Sam's results that he has got type 2 diabetes. And so we thought to make a plan for Sam to change for his diet, to refer to him a dietitian, to start exercise and to start some lifestyle modifications so that sugar levels come down and his health lifestyle becomes better. So I would also like to share some leaflets with you. You can go through them, and if you have any concerns, you can have another meeting and I can explain you there. Meanwhile, I can give you some contacts of the support groups who have had similar experience, and I think their experience will also help. What do you say, Ms. Mary?
Okay, okay, doctor.
Okay, okay, thank you.
Okay, thank you so much. Okay, you can start.
Hello. Hi, Mary. This is Dr. Srinivas Midvilli. I'm working as a pediatric registrar here. Is it the right time to talk to you?
Yes, doctor. What do you want to
So-
talk to me about? I don't know.
Yeah. So this is regarding your child Sam blood reports, which we sent yesterday. So do you want any other family members to accompany with us in this meeting?
No, doctor. Today I came alone to check the blood results. Is anything serious?
Okay. So let me explain in detail, then we can consider it. What is the problem exactly? So, would you like to know what is there in the blood test now?
Yes, doctor. Sure, I want to know because I
Sure.
thought you are arranging a meeting. There's something serious. That's why.
Nothing to worry, Mary. There are for everything we have treatment available nowadays, so no need to worry. So first we'll go with what exactly there in Sam's blood reports. So I'd like to explain that just now the reports came and it's showing the levels of the blood are more in Sam. So it can be because of a condition called diabetes mellitus. Did you heard about it?
Yes, doctor. I know diabetes very well because my
Okay.
sister has diabetes. I know this.
Okay.
But
Yeah.
I'm not seeing any problems in Sam, which I saw in my sister, like going to urine many times in the night, or
Yeah.
he also had an admission to the hospital. He's very normal.
Yeah, that's very good. You had a great idea about the diabetes, but the presentation can be different as I'll tell, because there are two types of diabetes. One is because of because of a lack of a chemical name called insulin. Other is because of the loss of function of the chemical called insulin. So right now we can see Sam is suffering with the second type of diabetes, where you don't see the features which you have said earlier. So can I tell you in detail about this?
Yes, but doctor, you're telling that these two diabetes are different. Then what
Yeah.
about the treatment? Sam has to take injections now?
Yes, I'll tell, because as we discussing, the problem here is because can I'll draw a diagram and explain you.
Okay.
Okay. So I think I can't. Okay.
Mm.
So I'm drawing a diagram explaining that. See what happens in condition where in type 2 the chemical name called insulin cannot help in taking the glucose from the body. So that's the reason that is more important chemical which should make the insulin make glucose to take into your body parts, but it doesn't act because of the there won't be any door to help the glucose to enter into the body parts. So here the insulin is normal in SAM. So we don't require any extra insulin given from outside. Are you with me, Mary?
Yes, so insulin is normal, so he don't want insulin. Then how we will control his blood sugar, doctor?
Yeah. So when we go through the other reports, the his other fat tests, fat test, blood tests.
Okay.
It might be because there is a excessive accumulation of fat in the Sam's body. So that is the reason he's also suffering with obesity. Are you with me,
Yes,
Mary?
yes, doctor.
Yeah.
So what you will do for him? How can I control his obesity now? You're telling he's obese.
Yeah. So that's a good question, Mary. So we can overcome this problem as together actually, because it is mainly because of lack of physical activity and consumption of extra calorie rich foods. So if you control these two things, we can come down on his weight, because of increased intake of calorie rich foods. This can happen. So I
But
guess you're getting.
everyone in my house is taking too much of food, and everyone is fat and chubby like Sam. So I don't think I can work out on this part because everyone in my family loves food. They want to eat more.
Yeah, I can understand you are all having a good relationship with the family, so you're going through. But first thing I would like to address is, if you want to control the overweight, it has to come from the family. So everyone has to follow these few lifestyle changes so that the results will be good. Are,
Uh,
are you getting? Are
Yeah,
you
I
getting my
agree
point,
with you,
Mary?
doctor. But the problem is, if I tell only, if I ask Sam to reduce food, others are also should work out, which is the most difficult part. I feel his father also loves food a lot, and they eat a lot. It's difficult part for me to control. So, can you tell me other measures? 6 minutes finish. Can you tell me
Yeah.
other
So
measures? How can I
yeah,
control?
other modality is increasing the physical activity. So going for a walk or going for a jogging for 30 to 60 minutes in a day will definitely help. So increasing the calorie consumption will bring down his weight. Are you getting my point?
Yes, doctor. But okay, but I think all these things will take a long time. Already, doctor told me before that he is fat for his age, and
Yeah.
I think this will take a long time. Any instantaneous solution you can give me to control his blood sugar now?
So there won't be any speedy treatment for this condition, because this all happened because of increased weight, and that might be because of lack of exercise and increased consumption of rich food. As I told, you need not to reduce the food intake. You can only reduce the extra calorie intake, which can be like sugary drinks, so and any fried foods. So if you decrease those things, I think you can come his weight down. Are you
Okay, doctor,
getting my
but
point?
okay, if I go only with this physical lifestyle modification, maybe his blood sugar will be constantly high in his body, and I know that there are complications. From my sister, I know very good about diabetes.
Yeah.
So he might develop complications. So I don't want to waste time waiting for this solution from this exercise and diet control.
Yeah, I appreciate your concerns, Mary. But in this type of diabetes, you don't see the complications because of extra sugars. Because here there is a chemical called insulin is present, so it will take care of that function where the child Sam will not go into problems like what you see in the other child. Okay, so here the problem will be only because of the not functioning of insulin, not because of lack of insulin. Are you getting me?
Okay, doctor. So, what is
So
your
today,
step?
yeah, yeah, Mary.
Mm. So, what you will do now? Any suggestions you want to give me?
So today we discussed about your child Sam, who is having um, uh, overweight and having issues with his blood glucose and with fat, excessive fat, blood increased fat tests. So this can be overcome with decreasing the calorie rich food and increasing the physical activity. And you can add one more point, like decreasing the screen time and spending more on the outdoor. So by this you can overcome this. I think I'm clear till now. So, and you can plot this his height and weight regularly, so that you will understand whether the child is coming down on his weight.
Okay, doctor. Thank you so much.
So I'd like to provide you leaflets and trusted website to you please go through, so that you will understand regarding the obesity.
Okay. Okay.
Okay. Thank you.
Okay, so 9 minutes you took, maybe few seconds more when the alarm finished, the 9 minutes were finished, but it's okay.
Okay.
I have comments I will give, just give me.
Yes. And age of the child,
Okay, wait, you wrote the name, age, then
age and the diagnosis like obesity, simple obesity, and as blood report showing HbA1c 7.5 and increase in triglyceride levels. And I wrote the task. What is the main task?
explanation of type. Yeah.
Explain of the diabetes mellitus.
So if I'm not wrong, I'm writing here. So you
Yes.
wrote the name, you wrote the age,
Age.
you wrote the diagnosis of the child, you wrote the blood reports, you wrote the triglycerides are raised, and you wrote the you have to explain
Explain
type.
task.
Okay, this much you wrote. Dr.
Yes, ma'am.
Mridula, did you write anything on your paper apart
Yes,
from
yes. I wrote whatever Dr. Srinivas mentioned. I wrote that, and I wrote in introduction. We, before disclosure, to invite someone to attend the meeting to check understanding. After disclosure of diagnosis, check understanding. Then I wrote advise. Under advise, I wrote 4 headings, and I wrote alarming signs, and I wrote risk. Under risk, I wrote heart, arteries, eyes, kidney, nerves. Then under advice, I wrote diet, exercise, lifestyle modification, education of family and child and family.
Okay. So here you wrote introduction, and this was diagnosis, right? D. What was this? Introduction.
Disclosing the diagnosis.
Okay, disclosure of diagnosis. So coming to the point, this one. Then you write about the advice, alarming signs.
Checking understanding.
But both of you, the main important point you missed was previous knowledge. You did not ask the mother previous knowledge at all. What do you know about your child's condition? Both the candidates did not address this to the mother before starting your task. Okay. So before starting your task, the previous knowledge is very important. Here you will lose the marks. If you don't ask previous knowledge, you will lose the marks. The mother should tell you what happened before you address her. This is not for only this scenario, any scenario. Previous knowledge part is very important. That means previous knowledge is what does the mother know about the child. This you should know before addressing the mother about his child. I don't think you both did. I am correct or wrong?
Yes. We just asked what is diabetes. Have you heard about diabetes? But we did not ask about child. Yes, you are right.
No, you know about diabetes. She told, yes, I know about diabetes because the sister has diabetes. But she knows about type 1 diabetes. But what you have to explain is type 2 diabetes, which is entirely different from type 1. Okay. And the management also differs. There's lots of difference here. So this is the role play going on here. Mother knows fully about type 1 diabetes, but you have to introduce type 2 diabetes, which is not much aware of about it. This is one thing. The second thing is I will tell this is for all. You should keep these points before entering any communication station. What template you have to prepare, you have to know, so that you will not do any mistakes. We will go through it now. Okay, just to give me 2. We will start. There are many people who make some mnemonics and all. Everyone has their own style. I will tell you how I do, but you can make some mnemonics or follow anyone. But your template should be proper before you enter into the station. This is very important. The 4 minutes, when you go to the 4 minutes is very precious for everyone, because in communication station, the thing will be very long like this. You have to read so many lines, but maybe the lines is just time consuming for you. You should know only few things out of so many lines. Okay, so that few things you have to highlight when you're in your paper. You will be given one paper, so I will write this 4 minutes is very important for us. Now in our scenario, what are the highlighting lines you should know is only the child is 11 years. Okay, his name is Sam and mother's name is Mary. Always write down on your paper child name and mother name, because many times we forget. Why we forget is, it's not because we don't like to remember names, it's because of the exam tension. You have 10 stations in front of you and all of you are worried. Okay, so you will forget the child name. So you will write his age, you will write child's name, and you will write mother's name. This is the first step you will do. So here 11 years old Sam, and then you'll write the BMI. What is his BMI? It is very important. Maybe you might use or you will not use, but you should know. You'll write here 35. Then also you'll note down BP. Just for you might explain or not, that is secondary, but you will note down just in case if you need. Here, very important point, parents are not concerned about the weight loss. That means when you are suggesting for weight loss, mother is not showing interest. She's telling, I don't think this will work because my whole family is eating. We are fond of eating. She's telling like that. She's not interested in your physical activity. And so since you're telling the same thing and she's telling the same thing, you are encouraging physical activity and she's telling, no, we want to eat more. I don't think this will work because the whole family is like this. So I asked you what other suggestion you can give. I will tell you that what other suggestions you can give. So this is very important. Parents is not concerned. So you will face problem here up from the mother, that she is not in favor of this exercise and diet. Okay. This is the point given for you in the next point for you. Here is the blood test. Yes, you will note down the blood test, HbA1c, you will note down. You will note down the fasting blood glucose. And also you will note down that the triglycerides are elevated and TSH is normal. So explain type 2. This is from the scenario you will note down. This is from the scenario. This is one part. The second part, what you have to note down always is what you will do when you enter. Because most of the time, if you are practicing too many times with your colleagues, you will not face problems with this. If you don't practice, you will face problems with the introduction. So introduction is always, you will say that this is Dr. Noor, one of the children's doctor in this hospital. Or again, I always suggest 3 types depending upon the age of the child. If the child is very small, less than 1 year, say baby doctor. If they are 2 to 5 years, say 2 to 8 years, 9 years, say children's doctor. And also for the teenagers, you can say child and adolescent doctors. It's your choice, but just use normal. Instead of using pediatrics, just say children's doctor or child's doctor. Okay. After introducing your name, you will confirm whether so am I with Mary, mother of Sam, 11 years old boy. So this is your confirmation. One is you will introduce yourself. Second, you will confirm yourself. The third thing is you will build a rapport. I don't know if I missed or something, but I don't think any rapport, any sentence of rapport was built with the mother. That thank you for coming here, or nice to meet you, or how was your journey to hospital. Different people ask in different way, but I usually say thank you for coming here and nice to meet you, something like this. I don't go into the question of how are you, because some people say that if you say how are you, and if it is something which is bad and they are not in bad mood, they might say I am not good doctor, like this, something they might reply you in a bad way or something. So they avoid this question. But even sometimes if you ask if the role player is good, they can answer in a nice way. But usually they say avoid this question, how are you. Do some other words of rapport, like nice to meet you, or thank you for coming here. I am very much happy to meet you here to explain, or something like this. Okay, but you should have one word of rapport. I think both of you missed. Am I correct, or did you say I missed? Can you just comment on this? Dr. Srinivas, did you make any rapport with mother? Hello? Okay, I don't know. And also, I think Dr. Mridula, she also did not do. So rapport, it was missed here. Okay. So you will write it down in your this what you will write that you will do the introduction. In the introduction, you will greet. Good morning. Good morning. This is Dr. Noor, one of the children's doctor in this hospital. Am I with Mrs. Mary, the mother of Sam? She'll say yes. Then there are rapport can be done in different way. Thank you for coming here. Nice to meet you. And also you can ask how can I address you, Mrs. Mary? She can tell you, just call me Mary, doctor. Like this, something. You have to speak 1 or 2 sentences for the rapport, and then you will clarify here your role. What is clarifying your role? You will tell that today I am here to tell you about your child. Today I'm here to talk to you about your child, Sam. But before that, you will start before that 2 sentences. One is the attender, which was very well asked by both of you. One is the attender. The second is the previous knowledge, which was both missed by both of you. So you'll write introduction, you will greet the mother, then you will introduce yourself, you will greet the mother, introduce yourself, and you will confirm whether she is Mary, mother of Sam. Then you will ask her about the child's condition, but before that you will ask for the attender. Tell her that today I am here to explain to you about your child's condition. But before that, do you want anyone to attend this session with you? And if she will tell no or yes, whatever, usually they say no, because single role player you're communicating usually. So no, everyone is busy or something, they'll tell you. Then you will ask about what do you know about your child's present condition. This was missed by both of you. You went directly to type 2 diabetes. No, you have to ask. If you would have asked me this, I would have answered you that my child, I had attended, I had brought him because he had upper respiratory tract infection to the doctor, but the doctor said that he is fat and chubby. So they told that every year he needs blood tests to monitor him. So I came for the second blood test this time. Now I am here to know about its reports. This much she would have told you. You did not extract this. How they diagnosed him as obese? Actually, he was not following up for anything. He is a healthy child. He came for the purpose of, he had some upper respiratory tract infection. He came, but they saw his height, weight, and they checked his BMI, and he's obese. So they asked him to, they asked for annual screening for him. Okay, this is going on from last year, 1 year. This is the second screening where he is diagnosed with type 2 diabetes now. Okay, so this is the
Dr. Noor, what should the question be while we ask for the previous understanding?
So as I told you, these 3 will come simultaneously. So after greeting, rapport, and introduction, everything is finished. You will start like this. So today I am here. This is your role. What is your role in this communication station? Your role is, today I am here to talk to you about your child's condition. Whatever it is, you are here to talk to them about their child's condition. This you can apply for all the scenarios. Today I'm here to talk to you about your child's condition. But before that, do you want anyone to attend this session? In 1 sentence, you will tell. She will say, no, doctor, all are busy, I am alone. Then you'll tell, can you please tell me, what do you know about your child's condition? Like this. After she tells, then only you will deliver the message. You will never come to you will never start delivering the message before checking the previous knowledge. This might undermark you or also fail you. Delivering the message without checking the previous knowledge. Okay. So if you check the previous knowledge, half of your work is done. Mother herself will give you half of the information, whatever is there in your scenario. You have to just add up to the things. But if you don't ask previous knowledge, you will tell the same thing. Did you get my point? How to ask? Are you clear?
Yes, clear. Thank you.
Then we can proceed now. So now you will do what? After previous knowledge, you will have agenda in your mind. What I should do. See here, both of you gave, not you, not Dr. Mridula, you gave more importance to the pathophysiology, but mother was not that much interested in pathophysiology. Sometimes what happens is you will have something in your mind and you will try to explain the same thing. No, communication shouldn't be like this. Communication should be with the flow of the role player. Here you will speak what role player wants to speak. We will not speak what we want to speak. Okay, am I clear for all? In communication
Yes.
ways, you will speak what the role player wants to speak. So you will just write it in your notes what to do, but it might not go as you wish. It will go as the role player wishes. You will have to explain pathophysiology of how this insulin works, whether it works or not works, only if the role player asks you. If not, no need, it's okay. Only thing here, the agenda here was, now what happens now, as I told you, we will come to the agenda. This is the middle part. Okay, all these things: introduction, greeting, rapport, clarifying your role, prior knowledge, all these things should be less than 2 minutes. It should be better to target for 1.5 minutes. Everything should be finished by this. You should start explaining about type 2 diabetes by the time you have crossed 1.5 minutes. So you will be left with how many minutes? 9 minutes, 6 minutes almost. You will have 6 minutes in your hand for the entire agenda, to give referrals, to give support groups and everything. Okay, after this finishing, now you will come to your task. In your task, mainly you have to avoid jargons. Okay, you have to listen carefully to the whatever the role player is telling, and also you should understand concerns, and you should show sympathy and empathy. Very important. And drawing, any drawing you want to do is very important. So this is the middle part. So now let us go to the middle part of our discussion. So here you have to explain type 2 diabetes, but when you started explaining about type 2, your child has diabetes. She says that she knows, but she doesn't show symptoms in the child. So what will be your answer is, you will tell her, maybe you would have answered, but I'm just telling the questions myself and answering now for the sake of all. So that if you have missed the points, all of them can cover up. Okay, most of the points you both of you covered, but maybe some points here and there left. So I'll just give answers to all the questions now. So the question here was, so when this is like a breaking bad news. When you told her that that her child has diabetes, she's telling you that he doesn't have any symptoms. So how do you answer for this? She says her sister she has seen symptoms, and even admission. Her sister was admitted for the first time when she presented with diabetes. Why I'm not seeing symptoms? So you have to tell that your child has a type of diabetes which we call it as type 2, and so it can present without symptoms. Okay, it can present without symptoms, and this is usually we see in obese chubby children. And this is the reason we screen them. Whenever the child is obese, they can develop some increase in the blood fat and also increase in the blood sugar without symptoms. This is the reason we prefer to screen them every year. This is one of the way you answer this question. Okay. And you will tell that why my sister presented like this, as you both explained this, that type 1 diabetes is, there is difference between type 1 and type 2 diabetes. And type 1 usually presents with more symptoms and in a more severe form, and they can get admitted. Type 2 can present in a very normal way and in a very asymptomatic way, and they may not need admissions. So that is why we screen these obese children every year, to know that, so that we can do early diagnosis and better management. Okay, so that we can know from the beginning their problems, and we can give the solution very well as soon as possible. This is in a way you will explain, like early diagnosis and management will help by screening them every year. By this you will tell them annual, how important is annual screening in obese children. Okay, this is one thing. Now both of you were, when she was telling you, yes, the solution, now you address the problem, right? Now when you wanted to, when the mother was telling about the how you treat it, she did not ask you about the pathophysiology. She asked her this question. She asked, okay doctor, now you are telling my son has different type of diabetes, which is not like my sister and which will not present in severe form. Now how do you treat it? Then you will go for the treatment. No need to explain pathophysiology for her. She is worried about the treatment. So you started with diet, exercise, lifestyle. Now mother is telling, no, I don't think this will work. So your other solutions here, what you did not tell was, you will not do yourself everything. You will involve the diabetic team here. So you will tell them that I will refer you to the diabetic team, where there are a team of doctors who will take care, who will follow up your child. Okay, I will refer you to the diabetic team. These are a team of doctors who will follow up your child. And here you have a gland doctor, okay, who will give you advice about how to control your child's sugar. And there will be a dietitian who will manage you about the diet. Okay. And when she said my whole family is eating, his father is also fond of eating, you would have told that we will arrange one more meeting with the father and the child, and also if they are in a big family, and also the siblings also, if it is there, the whole family, and we will discuss the what are the solutions now for this. When she says that I don't think my child can eat, my child can follow the diet and do the exercise. Now you will tell that you should work as a family. So let's arrange a meeting with the father and the child, and also if there are any other children in your family, and we will educate them about the importance of importance of controlling the diet and exercise, and how it will bring there. This is one thing. The second important point you both of you missed was the support groups. You did not talk about support groups. One is encouraging the family together. You will arrange a meeting with the father and also other siblings, so that all of them will maintain the diet and exercise and avoid screen time. Okay. So you will educate them. The second thing is, we will join your child to the support groups of the children suffering with the same problem, so that he will see all the other children with the same problem, how they are working hard to overcome this by doing exercise, by controlling diet, and other things. Regarding, she said, no, I want still more solution. You could have told that after the trial of this diet and exercise, there are also some tablets for this condition, medications for this condition, but at the moment I cannot advise you about it. So I will be referring you to the diabetic clinic or the gland doctor. He will follow up your child over a period of time, along with this diet, exercise, and calorie control. He will if he needs, he will add medication, like this. Okay, if he needs, he will add medication, but this child needs follow up with the diabetic clinic, and this child needs follow up with the support groups, which you missed, which is the very important things to address here. Okay, but whatever you said about the diet is very correct. Physical activity, encouraging the child to take 20 to 30 minutes of exercise daily with control of diet, reducing screen time. Everything is good, but you should also tell that you will send them to the diabetic clinic, and also you will refer them to the support groups. This was left, and try to finish your ending with referring and giving leaflets. Referral. Now here the referral is needed to the diabetic clinic. Next is you need to summarize. You need to give leaflets about type 2 diabetes. You will tell that I will give you a leaflet so that you can read more about it. And if you have any further concerns, we will arrange one more meeting with you. And also if she's not happy, you can also arrange one more meeting with your consultant. Okay, so this was missed. I think one more meeting arranging and summarizing was missed by the first candidate. The second candidate summarized. Okay, so try to give a short summary in the last. So anyone, any others have, this is from my thing. Maybe even I would have missed some points. The audience who are listening to our conversation have any comments which we missed, can give their comments now. Yes, any comments? Anything was missed by our candidates which you noticed?
Hello?
Yes.
Yes, Assalamu alaikum.
Walaikum salam wa rahmatullah.
Yes, when Dr. Srinivas was doing the communication, mother told that my sister is having this diabetes mellitus type 1 like that. He told you, good, you know about this thing. If you say that I'm sorry to hear your sister has this problem, rather saying good, and that gives
No,
a reflection of
yeah, I
his,
agree with you.
yeah.
Yeah.
He should say,
This
sorry,
good
I'm
here.
sorry to
Yeah.
his understanding regarding the condition. Then he should say, that's good, you know about the condition.
Yeah.
He should say, I'm sorry to listen that your sister has this problem, and that is good, you know all about the condition. So I believe you understand that I will explain to you in the meeting. So that would be the, starting point, rather saying good. The mother
I
go
understand.
other way around.
Yeah, actually, his I know his intention was that good
Yeah.
that she knows about the condition, but here it can be taken in a wrong way. This is the playing of words. Yes, you're right. So he has to tell, he has to show some empathy that her sister is suffering from diabetes type 1, and then he has to say that he has to appreciate her knowledge about the condition. Yes, you're right. And one more point here, Dr. Mridula, she used unfortunately. Even if the diagnosis is bad, I am telling for all of you, whoever is here, don't use this word unfortunately. Unfortunately, your child is diagnosed with type 2 diabetes, or unfortunately, your child is diagnosed with blood cancer, or whatever it is. Don't use this word unfortunately, because this will make them too much worried, and their response can be bad. I mean, they can feel bad, and can give you they can be more aggressive in their response, and this word will irritate. See, communication, even though you are breaking something bad news, it should be in a nice way, and you should not use any word which will make the opponent feel something that it is not good. See, unfortunately is not a right word, I always feel. Even if something wrong happens with us, for example, in our teachings, even if something wrong happens with us, we say Alhamdulillah, all praise be to God, all praise be to Allah, all praise be to God, like this, even in the wrong situation, even in the wrong condition. So even if something, we know breaking bad news is something like something wrong has happened and we have to break it, but still you will not use this word unfortunately. You will say that today I'm here to talk to you about your child's condition. Do you want anyone to attend? Then you will ask about the previous knowledge. Yes, after seeing the blood results, after going through your blood results of your child Sam, we have got to know that he is having a condition called type 2 diabetes mellitus. Even don't say he's suffering from a condition also. I avoid this word. I avoid unfortunately, I avoid he's suffering. All these words I avoid in communication. I say that he is having a condition called type 2 diabetes. This is my way. This is my way. The people can differ, because I want to avoid any word which hurts the role player in communication. Okay, am I clear? Anyone, how many of you agree with me? Just raise your hands in the chat. Okay, so good. Try to avoid these words, unfortunately, suffering, and all those things. You can use different words. Like today, I'm here to explain to you that your child, after going through the reports, that your child is having a condition called type 2 diabetes, and I want to explain to you about it. Like this, you can start. Okay. So anyone comments? Is it clear
Dr. Noor,
with communication station? Go ahead.
Dr. Noor, when mother asks some question, can we respond like this? Oh, that's a very good question. Or
Yeah.
we should only keep this phrase for medical students.
No, you can say if it is really a good question, like if you feel, but usually it is meant for the medical students, just to encourage them to ask more and more, because mothers' questions will be usually worrying questions. They're always
So
worrying.
we can say like that valid concern. Okay, you must worry about this thing. That is the thing. Valid concern is I think most appropriate, rather saying good question.
Yeah, valued concern, or
Yeah.
you should have
Thank you.
different you should have different communication sentences with you. You should prepare different communication sentences with you. And one more thing, what our candidates did not do was checking understanding. She wrote that she should check understanding, but every now and then you should ask them every 15 seconds, am I clear? Am I clear so far? Are you with me? Are you, see, I am telling you 3 to 4 different sentences for checking understanding. One time you can ask, are you with me? Am I clear so far? Are you understanding these points? Do you want me to repeat? Something like this. You should keep on asking, and this has to be checked every 30 seconds. Sometimes both of you were going long questions, and here the importance was not given to the pathophysiology, but both of you wanted to explain the pathophysiology because you had made a drawing already. Make a drawing and keep it. But if the role player is not interested in pathophysiology, don't go for it. No need. After you finish the explanation that your child has type 2 diabetes, she only said that my sister has this, then you compared about type 1 and type 2. She wanted treatment now. She jumped directly to the treatment. She did not ask you how this is happening to my son, what is happening in the body. No. Then go to the treatment. Your role is to go with the role player. Okay, not to tell that, shall I explain this, then I will explain you that. No, you will not do that. He is asking that question, you will go to that question. She is asking another question, you will go to that question. That is how you follow the communication. Okay, so anyone has any questions before we end the meeting? So support groups is very important. You have to write your template. All of you, please today only make your template. Okay.
Dr.
Before,
Noora, how frequently you are doing the communications, these sessions in a week, 2 times, 3 times? Or
maybe now it's more than a month. Actually,
my exam is on January.
so many
Because
we have so many communication recordings in our YouTube channel. Okay.
yeah.
So you can see in every communication station, our friends, most of them who have practiced, who are using the same sentences. You can see and you can learn from them. Okay. So everyone, they are using the same sentences. Few things, the greeting, the your rapport, because see, the role player whom you meet you will meet only once in both the session, and I don't think the same role player you will have in two communication stations. In one she will be different, in another she will be different. So you can practice the same rapport for everyone, no problem. For me, I usually used to say, thank you for coming here and nice to meet you. Only these two words. I never asked, how are you? Okay, this is one rapport. Some people say also, how was your journey and all. If you want to elongate, it's okay, but because of the time constraints, be short and sweet. And or you can ask, how can you just for how can I address you? If you want to avoid Mrs., you feel that telling every time Mrs. Mary is difficult for you, you can just ask, how can I call you, or how can I address you? Most of the time they say, just call me Mary, just call me whatever is her name, Colleen or something. So if you don't want this to use this Mrs. repeatedly, you can ask this question to them. It will also come under rapport. So just one or two sentences of rapport which you people missed is very important, and previous knowledge, because this will undermark you. They will cut your marks if you don't do this.
Yeah.
Okay.
I mean, once the mother here, the mother is saying about diabetes. I know about diabetes. Should I ask in detail, like what else you know about diabetes?
No, you will not
Because
ask question. No, you will not ask her any question. I know about diabetes, but she herself told you that her sister's presentation. But the way she said, all is going with type 1, because
type
she
1.
presented with polyuria, polydipsia. She had an admission, and also she's taking injections. This is clear for you that this is type 1, and also she's talking about complications which are more common in type 1. Type 2 also you will have complications, but after a long period of time, right? So when you know that she's talking about type 1, no questions will be asked to the role player. Only role player will ask you the questions in communication station.
Yeah.
Okay.
Right. Thank you.
So you can watch our videos on the YouTube, so that you will get to know how to introduce yourself, the starting part always. If you watch repeatedly, you'll get to know. Okay.
Sure.
Dr. Noor, I had a doubt.
Tell me.
Yeah, so many times when we start the communication session, when we ask them, do you want somebody else to accompany? That time itself, mother's response saying, doctor, is there anything serious, very anxiously, no? So how do we handle that question?
You can say that, yes, yes, Mrs. Mary, I am here to address you about your child's condition. But before that, I also want to know that do you want anyone to attend this session? And also, I want to know, what do you know about your child, so that I can give you a better answer about this, like this. Is there anything serious? You have to avoid telling her, yes, there is serious. As I told you, the words which sound dangerous has to be avoided in communication, like unfortunately your child is suffering, unfortunately your child is suffering from type 2 diabetes. You are using two words which are like bombs to the mother. For any mother, even if the child gets hurt a little, it's a great hurt for her. This is what is my feeling after working in pediatrics for such a long time. So using these words will make them too much worried. So avoid the word. You can tell that, yes, is there anything serious? Yes, Mrs. Mary, I am here to discuss to you about the tests, what we have received. But before that, do you want anyone to attend this session? And also let me know what do you know about your child's present condition, like this. And you will not put the two questions at once. You'll ask, do you want anyone to attend? If it says no, then you will ask the second question. Okay, is that clear?
Okay.
And you will not tell her yes serious, you will not tell her no serious. Your answer will be in middle. You will not answer her yes, you will not answer her no. You will tell her that I will explain to you about it. Okay. Anyone have
Okay.
other
Yeah.
concerns before we end the meeting? Okay, from next time we will do anything. Always before starting the task, we will again go, always we will discuss the template, so that the candidates will try their level best not to do mistake in the template. Okay, we will do it next time, inshallah. Okay, thank you all for attending. I will end the meeting now.